For so long in cancer treatment, it was very clear that there were pediatric doctors that treated pediatric patients, and then there were adult doctors that truly treated only adult patients. What we're realizing now is that there's more in common between pediatrics and adults, especially in terms of cancer care, than previously thought. So a lot of academic centers, including ours, are trying to kind of bridge that gap and share ideas and learn from our pediatric colleagues, just like they're trying to learn from us. And we're realizing that patients are better for it and patient care is better for it too. The adolescent and young adult population have the rest of their lives ahead of them. I think because of that, a lot of people get really sad when they hear about young people getting cancer. But I think the good news is that there is hope, and there are physicians that are focusing on it and trying to figure out why this is happening to young people. There are also physicians that are really focused on curing these young people and then making sure that they can live the rest of their lives without any issues or with minimal issues and side effects of their treatment. The adolescent and young adult gap, or the AYA gap, is this notion that researchers like myself talk about where when we look at the survival rates of adolescent and young adults, we notice that those survival rates lag far behind the survival rates of children and the survival rates of older adults. One of the reasons for that is the biology of their disease specifically seems to be more aggressive, but ultimately, again, getting cancer during this time is incredibly disruptive. You get kicked off your parents' insurance, or you lose your job and you don't have insurance. So there's a lot of financial reasons for that. There's also a lot of things that we as a medical community can do to improve it. While I do agree with the science, obviously, that patients in this age group have a more aggressive type of cancers, I do think that there's societal things and things that as a medical community we can do to improve that gap.